2, 1. Since November of 2009, BVMI has offered free, comprehensive, and high-quality health care to low-income, working adults living in Bergen County who have no health insurance and who cannot afford to pay for care.
I first came to BVMI because I didn't have medical coverage where I was working, and I needed medical attention, and someone told me about this program, and I'm very glad they did.
If I didn't come to BVMI, I will be laying up somewhere sick or feeling sorry for myself, and I'm glad that I'm not that way.
One of the aims of BVMI providing care to the community is to manage problems in a comprehensive way and to recognize as well as to treat problems before they become acute problems that require visits to the emergency rooms.
BVMI serves as a medical home, providing care for our patients' chronic and immediate needs.
And then we'll check your blood sugar.
Mr. Ukias is a 65-year-old man from Ecuador who's been followed at the BVMI since about 2010. ¿Cómo puede caminar? I was asked to see him in May of this year because his many medical problems have become very complicated and difficult to manage. Chest pains due to coronary artery disease, which was not well controlled. Joaquin, unfortunately, would be facing an early demise, an early death, if these problems are not kept under control.
Like many of BVMI's patients, Joaquin Ukias does not speak English. But BVMI staff members speak several languages. Through their efforts, Joaquin has received excellent care and his health has significantly improved.
Today, which is now about 4 months after I had seen him, Mr. Ukias hardly has any chest pains. His breathing is much better. He's in a much better place than he was before.
BVMI is staffed in part by volunteer practitioners and receives no state or federal funding. BVMI relies solely on the donations provided by private contributors.
One of my grandchildren said to me, Nana don't look like a grandmother, and I said, what do a grandmother supposed to look? He said, bent all over. I said, well, give me a hug because this grandmother's not bent all over.
The doctors, the nurses, even their other staff members, they're all very caring, and I would recommend it to anyone. And I hope they're able to expand. I really hope that they can get whatever they need, that they can expand, because it is much needed.
I'm on the right schedule of my life, and I feel good about it.
I feel safe. I know there's somebody there for me. Somebody who cares whether I live or die. I'm all alone, and they're there.
It is because of your generous contributions that BVMI can continue to provide a culture of caring for our patients and support for their families.